SAMRI acknowledges the Kaurna people as the traditional custodians of the Adelaide region, where our buildings are located. We recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. We honour and pay our respects to the Kaurna elders, both past and present, and all generations of Kaurna people, now and into the future. We acknowledge all other traditional owners who live across South Australia, with a special thanks to those whose lands we visited in the production of these videos. This video has been made for general information only and should not replace medical or professional advice. Speak to your health practitioner if you have any questions related to your health or medical condition. The South Australian Aboriginal Chronic Disease Consortium does not specifically endorse any medicines or treatments described in this video. Aboriginal and Torres Strait Islander viewers are warned that the following video may contain images and voices of deceased persons. When you have diabetes, it is important to be active every day, eat healthy food, and take medication as prescribed by your doctor. In this video, you will hear from health professionals and community members about what helps you live well with diabetes.
Part of it is the things that patients themselves can do by trying to be careful with the sorts of foods that they eat, to decrease the amount of stress and load on the body to try and manage the sugar that comes in. We want people to exercise more, largely because what that does is it makes your body better able to mop up or use all of the sugar that's circulating in your body. So it's like cleaning the system out of the excess sugar as much as we can. The other way is really dealing with medicines.
The traditional lifestyle of Aboriginal and Torres Strait Islander people is very healthy. People moved around a lot, hunting, gathering bush tucker, and caring for country, which not only provided healthy food, but also kept them fit. Matthew, Fabian, and Benjamin share how they use walking to increase their physical activity. Being active really helps their diabetes and helps them feel well in body and mind.
Yeah, and the exercise on top of that, when you're going hunting and fishing and things like that, you're burning that off as you go, where, previously in roles of jobs and things, and more these days, we're sitting behind a computer or at the desk and not getting those steps up. In my previous job, I'd probably only do about 2,000 steps in a day. Now working at the camping shop, I'm walking around and my daughter asked me to have a look at my phone one day and I didn't realise it tracks your steps. And she said, "Dad, you're doing 9 to 14 Ks a day over the last 2 weeks." And that's, I really feel that within myself as well, feeling a lot better from that.
At the moment, I'm the groundsman at Mallee Park and I'm starting to lose weight and I'm controlling my weight by doing the groundsman work there, and that's a big bonus for me. Well, working with the groundsman stuff, you're pushing mowers, you're whippersnipping, you're always picking up rubbish around the place, and you're doing edgings and whatever, and emptying bins and that, and you're really working. You're really working the body over, but and you know that if you're doing that, you're really keeping your weight down, and that way there you know that you're doing good for your body.
My sugar for the last 2 or 3 years has just been around the 5 and 6 mark. But the main thing with it, the catch is you must exercise, and like I work 5 to 6 Ks a day, just walking around the yellow community. I don't worry about anyone else because that's my exercise, and I've got to do that to stay fit and also to make the heart work and everything else.
Remember to check with your doctor before starting exercise. Also, if you are on diabetes tablets or insulin, you should talk to your health professional about your risk of hypoglycemia. Hypoglycemia, or hypo, is a condition in which your blood sugar or glucose level is too low. Signs and symptoms of hypoglycemia vary from person to person and can come on slowly or quickly depending on the cause. If you don't treat the hypo, you can become unsteady, confused, or even unconscious. A hypo action plan is really important as it offers information about the person's type of diabetes, their signs and symptoms, and their specific treatment. A hypo action plan also records other issues to consider. For example, driving or when not to drive, use of a medic alert, glucogen hypo kit for severe hypos, family contact details, and advice on when to contact their doctor or call an ambulance. Let's hear more from Tanara Tui, who is an Aboriginal health practitioner with Wataparuna Aboriginal Healthcare Service.
Physical exercise is really important for diabetes management. It doesn't have to be an expensive part either of managing your diabetes. You don't need to buy a new pair of shoes or having gym memberships. It could be just a matter of going to the park, playing with your kids, going for beach walks. It helps to lower your sugar levels, and it also helps your mental health status as well, keeping you physically healthy and also mentally healthy. So if you could aim for 30 minutes a day, 60 minutes would be fantastic, but of course you need to see what your GP has recommended for your health status.
Along with exercise, eating a healthy, balanced diet is very important. Dietitians are a part of your diabetes healthcare team and can help you with your healthy eating habits.
Another very important role that someone living with diabetes can undertake to improve their diabetes control is to be very mindful of the foods that we're eating as well. If your service has access to a dietitian visiting, that would be a fantastic idea for people to go and speak with a dietitian.
In regards to healthy eating, we recommend eating from the Australian Guide to Healthy Eating, so eating food from the 5 food groups. As you can see here, we have the breads and cereals group, we have the protein group, so they're your meats, chicken, fish, eggs, tofu. We've got your vegetables, and then we've got your fruit, and dairy. So we want you to eat from all of these 5 food groups every day. Fresh is best, but then canned is okay, and even frozen. It's also good to have a variety of these foods too, because all of these foods have different minerals and different vitamins in them, which help you prevent you from getting sick and keep you healthy. And then you can see in this corner here, there are the sometimes food. So they're your high sugary foods or your high fatty foods, so your takeaway foods. And then over in the other corner are your fats. So we have these in small amounts.
Yeah, it is important to have 3 meals. In between, sometimes I have light snacks. I have cereal, porridge mainly. It's a favourite in my household. For breakfast, lunch, I usually have a sandwich or just whip up a salad and some cold meat. Tea time, we have steamed veggies, some chicken, or sometimes we have some meat with it, or yeah.
Just watch your health and cut out on some takeaway stuff mainly, and eat healthy, and drink a lot of water instead of the soft drinks.
The food I used to eat was a lot of takeaways, a lot of sugary drinks, but now I've cut down on the sugary drinks. Try to drink a lot of water and just try to eat a lot of fruit and veggies.
Too many sweet things, sugars, or I love my sweet cakes and whatever else, did used to, but now I've cut right back. And today, my level's at a pretty good position at the moment, and I'd like to keep it that way.
The traditional diets of Aboriginal and Torres Strait Islander people is very healthy. Traditional diets include vegetables and fruits and are low in fat, especially the unhealthy fats. Healthy fats are made up of lean meat, such as fish and chicken. It is best to stay away from processed meat, such as frits, ham and bacon. George, Cheryl and Pauline talk about eating bush tucker and how it helps them.
You know, you got a variety of bush tuckers. You got condongs, you got bush onions, you got bush tomatoes. You got a variety of grass and seeds that we used to process and consume. Then you got your meat, you know, which is kangaroos and emus and goannas and bush turkey, if you want to put that as a part of a diet. But these are the, I mean, not that you eat all of them at once, but you have a variation of these diets, and it comes in seasonal. A lot of the seeds and fruits are seasonal fruit, so you're not getting everything all at once.
You've got, you know, your wattle, your snakes, your goannas, your emus and emu eggs, kangaroos, wombats, widgety grubs, everything, you know, and then it just shows you that this is the type of foods that you can have in our great country, in Australia, you know, it's our stuff.
Diabetes, you need to eat healthy, and that involves like veggies, less meat and a lot of veggies and a lot of fruit, and like kangaroo meat, and some of the bush tucker's good too.
What else helps my diabetes?
So self-management skills are extremely important. So taking medications, if you've been prescribed any oral medications or injectable medications, is extremely important. Checking your blood sugar levels regularly, having healthy checks at whatever health service you are visiting, and being aware of the symptoms of high blood sugar, because a lot of people aren't actually aware that feeling excessively tired, they may find that they're weeing lots and lots, especially at night time. That's a side effect of diabetes that's not as controlled as it could be.
We hope this video has given you some ideas about what can help your diabetes. We leave you with a message from Rachel Elivaris, accredited practicing dietitian and diabetes educator who works with the Aboriginal community.
And I would just like to stress the importance of seeing your dietitian on a regular basis, as well as a credentialed diabetes educator on a regular basis. Being in contact with these health professionals will help you manage your diabetes and looking after your blood glucose levels to prevent further complications on down the track.
Dietitians, diabetes educators and exercise physiologists are all part of your diabetes healthcare team. You can access these services at your local health service. We hope you have found this video helpful. For further information and resources, check out the links on your screen now. The South Australian Aboriginal Chronic Disease Consortium would like to thank the following Aboriginal community members and health professionals who participated in this video. This suite of diabetes video resources has been made possible by funding from Country SA PHN.